I had a hip replacement, and a year ago, September the 6th, and so far, everything has been perfect. The nurses was having problems of keeping up with me, going up and down the hallway. Within 2 or 3 days after the surgery, she said, "There's no way that an 87-year-old fellow like you could be walking like this after a hip surgery." I said, "Well, I have no problems. I keep right on going."
We did his hip replacement through the front of his hip. It was an anterior, what we call a direct anterior total hip replacement, using a special table called the Hanna table to get to his hip without disrupting any muscle, tendons, or ligaments. This is what's called our Hanna table. This is a table that we use for total hip replacement surgery when we go through the front of the hip, called a direct anterior approach. And by doing this, we're able to do it with minimal trauma to the soft tissues. We're able to get our patients up and going immediately the day of surgery, and even get them out of the hospital quicker. We've had people come in and have the procedure and discharge the same day, but most of our patients stay one day, go home the next day.
I had no pain from the time I did the surgery and right now. And now that I've got 6 great grandkids, I'm really enjoying those. Yep, we play kickballs, croquet, and all this kind of stuff out in the yard. We stay pretty active with them as much as possible, yes, and really enjoy them.
I tell Mr. Warnock all the time, I did the easy part, he did the hard part, the rehab and the therapy, but he's been a great patient and doing well.
They've been real good to me and treated me real well, and all the nurses, doctors, no problems there. It's just wonderful how they've taken care of me.